It's not this thick, it's this thick. It's 1,100 pages, and if you've read it, you can leave. I have read every page of the Affordable Care Act, and my background is in behavioral health, and I once, a clinical supervisor said a really great thing to me once. She said, Alex, human beings have the most complicated descriptions for the things they understand the least. And the Affordable Care Act and the American healthcare system is an extreme example of a set of perverse and extremely complex incentives that don't make any sense. And for those of us born after 1965, that's me, the Affordable Care Act is the most sweeping federal legislation in our lifetime, and it offers an extraordinary opportunity to close one of the great moral and ethical gaps of our culture and society's experience. So I'm going to give you a real simple breakdown. My job in the next 3 minutes is to distill the 1,100 pages of the Affordable Care Act so you can talk to your staff about it. And I'm going to take a shot at it. I think I can do it, actually. So go back to 1965, right? That's when Title 19, or Medicare and Medicaid, were created, right? Medicare for people over 65, Medicaid for poor people. But to get Medicaid, you had to be a kid and poor, right, under 18, and we'll come back to that because we've learned some real important lessons in the juvenile justice system. You had to be under 18 and poor, but if you were between 19 and 64, you had to be poor with a dependent child or disabled, right? Making us the only industrialized nation in the history of the world that offered no medical safety net for the medically indigent adult, the only one ever, leading to more than 50 million people being uninsured. And this is really important because not only is that in and of itself a failure, but actually what most people don't know is that the healthcare system is complicit in the stabilization of poverty. And in fact, I would argue that multi-generational poverty is the most common challenge facing both the healthcare and the criminal justice system. Because think about it for a second, right? We write this law called EMTALA, and that law says that if you show up in our 911 rig, no 911 receiving center can turn you away. If you walk into an emergency department, you can't be turned away. We, by law, have to treat you. But we can charge you whatever we want. In fact, medical debt is the leading cause of financial ruin in California. 1 in 4 bankruptcies are driven by medical debt. And one of the problems that this multi-generational poverty has brought is that the uninsured show up in the hospital emergency room, get a bill, they can't pay it, they can't get credit, they can't get a car, they can't get a job, they can't stay in their housing. So this interaction between poverty, the health system, and the criminal justice system, we have a chance to interrupt that cycle with the Affordable Care Act in a new way because now, under the Affordable Care Act, everyone 0 to 64, under 138% of federal poverty, so under about $15,000 a year, gets Medicaid. Everybody. Right? It used to be just kids, or just women with a dependent child, or just the disabled. Now it's everybody. And just quickly to note, people sometimes say the Affordable Care Act is a welfare program. That's not true. The vast majority of the uninsured in America are actually the working poor. In my county, 55,000 people will get Medi-Cal January 1st. We have 46,000 of them pre-enrolled and got a unit of service in a medical home this year. That's the highest penetration rate in the state. But 107,000 will get commercial insurance under the healthcare exchange. So just for most of the folks we're talking about today, and I haven't seen that study of the 7,000 inmates, and it was fascinating, and I want to get my hands on it, because it tells that story, is that the vast majority of folks in detention, in fact, we think about 90%, are going to be newly eligible for Medicaid in the adult criminal justice system. Historically, that number was between 10 and 15%. And I won't repeat some of the extraordinary points made by the sheriff in LA, because I think that was an example of enlightened understanding of the opportunities available to the criminal justice system through the Affordable Care Act. It is about treatment. The criminal justice system has become the placement of last resort for the mental health system. And there are numerous studies in the literature, most recently in JAMA, that show incredible reduction in rates of recidivism for the mentally ill population that gets connected to evidence-based care. The Forensic Assertive Community Action Team model that we have in Alameda County, that's actually throughout the entire state at this point, is a proven intervention for the seriously mentally ill. Over 90% of Forensic Assertive Community Action Team service recipients never go back to jail. That's an extraordinary statistic, right? Get somebody a home, get them access to regular treatment, keep them on their meds, they don't go back to jail. So the Affordable Care Act provides this extraordinary opportunity for an expansion of Medicaid to the populations that we serve all the time, which we know will reduce recidivism, but we have to build this culture of coverage. And these are in communities that have no history of coverage. So before I go on, the Affordable Care Act now says everyone 0 to 64 gets Medicaid. This will be about 90% of the current criminal justice population. It will bring in hundreds of millions of dollars to safety net systems in the healthcare delivery system. But it will also bring in direct resources to partners in criminal justice. And we know this because we did it in Alameda County, and I'll tell the brief story because remember kids? For kids, we've had expanded eligibility for Medicaid for quite some time. I don't know if you know it, but it used to be called Healthy Families. It's now been rolled into Medi-Cal, and at the federal level it was called S-CHIP. So folks, if you remember, basically in the late 80s, we said for poor kids, we want to make more of them eligible for Medicaid, and we covered them up to 250% of federal poverty. And in the process, covered in my county another 25 to 30,000 kids. In Alameda County, and I recognize that Chief Fenton, and I'm sure Chief Blevins maybe isn't here anymore, but all the Alameda County staff who's here, really, we took a careful and long focus at our juvenile justice population when we built our new Juvenile Justice Center in 2007. And in the context of, was it AB 81 or SB 81? In the context of SB or AB 81, which meant that we had more young people detained locally. When we opened up our new Juvenile Justice Center, we bused 340 young people from the old one to the new one. Today, there's less than 180 young people in detention. And we did that largely through partnerships with our partners in public safety and through leveraging Medicaid for treatment resources and diversion. At the very first thing we did is, like you have your drug and mental health courts, we took the seriously mentally ill children out of detention because one problem with having folks in detention on Medicaid is you can't bill for them while they're in detention. Right? Isn't that a crazy thing? It's actually something that we really have to change as a culture and a society. It's called the inmate exception, and it's a restriction on federal financial participation for anyone who's a resident of a correctional facility. So the Affordable Care Act will provide these new resources. It's also going to provide new opportunities to create alternatives to detention because we can pay for it on the outside, we can't pay for it on the inside. But there are also opportunities for revenue generation for criminal justice partners under the Affordable Care Act that actually we've already taken advantage of. And I want to say again what an enlightened presentation I heard from Los Angeles, with one small exception, is the Affordable Care Act has actually been the law of the land since March 2010. It's true that the Medicaid expansion begins January 1st, 2014. But in Alameda County, under the Low-Income Health Program, we've already been billing, already creating revenue for those inmates who leave the facility for inpatient care, right? And that's true. After January 1st, if you're a sheriff and you're holding a contract with Corizon or some other provider, when an inmate leaves the facility and goes to any licensed general acute care facility, they become eligible for Medicaid the minute they leave the facility. Their care is reimbursable at 50%. Most of your contracts currently read a bundled payment for a total service. And some of your contracts, I know in Alameda County, I've looked at it very carefully, read that your provider now must seek third-party revenue, and they split it 50-50 with you as the public sector. Well, I take a careful look at those clauses. It's true that there are new opportunities for revenue generation, but only if your contracts require it, only if your provider has the capacity to secure it. So you have to be Medi-Cal certified, you have to have a licensed clinic. These were things that never had to be true of inpatient settings because you never had an opportunity to secure revenue. And finally, for those smaller number of folks who aren't Medi-Cal eligible but who have commercial insurance under the exchange, their insurance can't be terminated until after they've been a resident for more than 30 days. So there's opportunities for revenue generation for services provided in detention for a small percentage of the folks who are in detention. It's not actually that small, 10 to 15%. So these are big numbers. So there are direct and specific ways for current criminal justice partners, public safety partners, to offset significant expenses. And this is where the bad news begins. So I've told you all of your folks are now eligible. There'll be new opportunities for them in the community to reduce the amount of times you see them in detention, to connect them to much needed mental health and alcohol and drug services. There's a couple problems. The first is, even though it's my field, we're not so good at it. Most of the technologies we're using in alcohol and drug and behavioral health treatment are new. New, and I heard the speaker before me talk about cognitive behavioral therapy and other evidence-based practices. They're new in that we've only been at them since throw out Freud, right? Let's begin with most of the technologies we're currently using are really only appeared on the scene and have been evidence-based for the last decade, maybe 15 years. So understand that a lot of the work we're doing isn't mature. And it also doesn't address the root causes of poor health outcomes. You don't treat away poverty. The best therapist doesn't get you a house, a good job, a sense of meaning and belonging, and hope for the future. So there are what we call these in the healthcare field the social determinants of health. So while I welcome the Affordable Care Act, it will not change the fact that healthcare costs are rising at 5 times the rate of wages, and that premiums for every employer are doubling. They doubled in the last decade and they'll double again in the next. What the Affordable Care Act does is gives us an opportunity to create revenue for public safety partners in new ways. It provides an emphasis on out-of-detention treatment. It will create new connections between public safety partners and community-based health and mental health providers. And it will offer us an opportunity, I hope, to liberate the positive wisdom and intelligence of the people we serve. And if you don't believe in that, then we should just keep building jails. Because there is an extraordinary thing that is happening. And I'll end with this story, because I think it's a model of what we could do in the adult system. As I mentioned, in the juvenile justice system, we reduced by 50% the number of children in detention, largely leveraging Medicaid and collaborating effectively with leadership in probation who really led that reform. But in our juvenile detention facility in Alameda County called Camp Sweeney, the woman who was running the camp called us up one day and said, "Hey, Alex, we want to run career day. Can you send up the EMS staff?" So we flew the helicopter in, we sent the ambulances up, and we ran career day. And the 90 boys at the end of the day write what they want to be when they grow up. And for years, they'd always wrote probation guard or police officer. Because for these young men of color, the men that they had seen as role models were often police officers or probation guards. And Wilma Robinson, the camp director, said to me, "Alex, it's crazy. 17 of them wrote EMT." So our staff, on their own, by the way, with not my knowledge, started volunteering on Saturday afternoons, teaching kids about the EMT program, about what it was to be an EMT. We learned about that and said, don't do it on Saturdays, go on your own time. In fact, let's train young people in the first portion of the EMT curriculum called First Responder. And 6 months in, our staff said to us, look, the kids, they can't read, they need more than what we were given, and we need to open up our building on Monday and Wednesday nights because we're the health authority, we certify all EMTs. We did so on the first night, 54 young men lined up outside our door. Admittedly, some smelling like marijuana and looking a little rough, right? But 54 lined up, and 6 months into training them, our staff said to us, look, Alex, it's not working. They're getting shot, they're going back to jail, they're taking jobs at Kmart, we need more. And plus, even when we train them, if they pass the National Registry exam, they're not ready. They haven't had jobs before. We need to teach them what it is about the culture of work. So with the support of an $800,000 grant from the Robert Wood Johnson Foundation, we created the Alameda County EMS Corps. We've now had 78 graduates of the Corps. 58 are currently working in our 911 system, all young men of color. 10 are in college. 4 have other jobs, and 4 we're looking for. I think that's 78. Anyway. The reason I'm telling this story is because when you go to Oakland, right, and don't believe the hype, there's lots of incredible people in Oakland. When you go to Oakland, beginning in January, on the left-hand side of the bus stop is going to be a picture of Carl Bowles, 6'4", African-American, gold teeth. And it's going to say, and his jeans and his t-shirt, and it's going to say, "Hi, my name is Carl. I'm not what you think I am." On the right-hand side of the bus stop is going to be a picture of Carl in his EMT uniform saying, "I'm going to save your life." The Alameda County EMS Corps making superheroes every day. The point I'm trying to tell of the story is, the EMS Corps is a story of connecting behavioral health treatment to employment and training and leveraging the power, the purchasing power of the public sector. Because we now require that our 911 service provider and our interfacility transport providers hire our kids. Give us 15 years. In 15 years, every time you call 911, 120,000 times in Alameda County, half of all the 911 responders will be young men of color who were born and raised in Alameda County. If we have the courage to leverage Medicaid, the treatment resources, leverage the employment and purchasing power of the public sector, we can change the culture we live in, and that's the opportunity of the Affordable Care Act. Thank you.